Hello everyone, I'm Dr. Bhargavi, endodontist. Today I'm going to discuss about the root canal treatment and why the root canal treatment is actually done. Each and every tooth has three parts, that is visible outside. It has three parts: enamel, dentin and pulp. Whenever the caries part, that is the bacteria, attacks the enamel, it is the outermost protective layer. Whenever the bacteria attacks the outermost protective layer, that is enamel, it attacks the dentin. So the dentin has tubules, and the bacteria can spread through the tubules into the pulp, causing the pulpal irritation. See, this is the model in which the caries has involved the enamel, dentin, and it has reached the pulp. So whenever the caries reaches the pulp, the pulp gets irritated, and sometimes this irritation or the inflammation, it may spread into the surrounding bone also. So in such cases, the patient may experience pain, swelling, and some sort of irritation. So whenever the patient comes with such sort of pain, so this is the IOPA, like the X-ray, in which we can show the caries involving the enamel, the outermost layer, and it has entered the dentin and it is reaching the pulp. This is the pulp, the black one, and the caries has reached the pulp. In such cases, whenever the patient comes, we prefer to do a root canal treatment in which the infected pulp is removed entirely from the tooth, that is from the coronal part and the radicular part. These are the roots, and the pulp should be removed from the roots also. So after the pulp is completely removed, the canal should be cleaned, and then we should fill the entire crown and the roots with the filling material, and that should be biocompatible. So this is the root canal treatment, and in our further sessions, I will discuss about the recent advances and further topics in the root canal treatment. So I came across many patients who are very scared of the root canal treatment. But root canal treatment is never a painful one, because root canal treatment is always done under local anesthesia. So whenever local anesthesia is needed, that is in cases of vital teeth, where the pulp is still alive, then we may give local anesthesia and go for the procedure. But some teeth, they may become non-vital because of the injury, that is like the injury had occurred many years ago and the tooth became non-vital. So in such cases, no LA is needed, and we can do without LA also. So root canal procedure is never a painful procedure. Root canal treatment, it can be done in a single visit, which is called as single visit endodontics, or it can be done in multiple visits. So it is not mandatory that we do root canal treatment in a single visit procedure, because in some cases where the infection is more and the infection has spread into the bone where the radiolucency is present, and if the patient has pain and if pus is oozing out of the canals, then in such cases, single visit root canal treatment is not done. Single visit root canal treatment is done in cases where the patient doesn't have any pain, or the patient doesn't, when we examine the X-ray, there is no radiolucency or infection spreading into the bone. In such cases, single visit root canal treatment is done. And coming to the advances in root canal, before, the root canal treatment is done using hand files, where there is the instruments, they are operated with the hand. Okay, so now there are many recent advances coming, and we have so many rotary files where these files can be operated using the endomotor. So in such cases, what we do is root canal has become so very easy, and it is like a single visit root canal treatment is mainly it is being done because of the advances in the rotary instruments.